kind of give you a background, Mali is a landlocked West African country, significant under 5 mortality. They've made the country as a whole, as many parts of Africa have made major strides in dealing with infectious causes of under 5 mortality. But we know there's non-communicable diseases are still a significant portion of that under 5 mortality across sub-Saharan Africa. We know that determining the prevalence of sickle cell disease in that part of Africa has been difficult due to lack of wide-scale screening for sickle cell disease. And historical screening measures like IEF or HPLC, the old standards of diagnosing sickle cell disease, have been difficult to replicate on a larger scale in those environments because of lack of reagents, consumables, supply chain issues, trained personnel issues. And therefore, the idea about point of care testing for sickle cell disease is rapidly increasing in sub-Saharan Africa. And so we wanted to look at, for the first time, point of care testing in a rural hospital in Mali, West Africa, the idea of doing systematic point of care screening of all newborns born at a single hospital. And so that's what we set out to do. Starting in March of 2019, we used the Hemotype SC point of care test kit, which is out of Silver Lake Research in California, that company. And we screened every baby that was born at Kuchala Hospital in rural Mali was offered screening through this point of care testing. The great thing about point of care is that the results were available within 10 minutes. Those results could be given directly to the family, and then that individual, that infant that was diagnosed with sickle cell disease, could be put directly into the outpatient sickle cell program available at the hospital for standardized care. So by doing point of care, what we found is that out of the approximately 5,700 babies that were born over that 2-year period, we had 99% of those babies that were able to be screened. We compared that data to historical screening methods using isoelectric focusing that many times we were out of reagents due to difficulty getting them into the country. And only 46% of the infants born with that historical method were actually screened due to those complications in terms of the technique of screening. So significant improvement there. We found that about 2% of the babies tested positive for sickle cell disease, and those infants were able to be put into the standardized treatment with management for malaria, with penicillin prophylaxis immunizations, the availability of hydroxyurea, and those standard things that we know make a difference in terms of saving lives with sickle cell disease. That's been ongoing. Additionally, the hospital's been able to test infants born outside of the hospital and those women and children who have symptoms that would be suspicious for sickle cell disease. And through that testing, they've identified another, over 180 or so individuals with sickle cell disease through symptomatic testing additionally. And so looking at that and putting this screening in place where point of care is less expensive, less than $2 a day, better able to screen more of the babies that are being born at the hospital. What we're finding is this is a more desirable method. It's reproducible. It's a more desirable method for larger scale testing in the future, and we're excited about that.